Brandi Glanville, known for her time on reality television, has opened up about a prolonged and deeply distressing health ordeal that dramatically altered her appearance and daily life. For an extended period, she believed her facial disfigurement stemmed from parasites she may have contracted while traveling abroad, specifically during a filming trip in Morocco the previous year. She had been adamant about this explanation, sharing her concerns publicly and seeking various treatments to address what she described as severe deformities and infections affecting her face. The reality star invested heavily in attempts to resolve the issue, spending more than $130,000 on medical consultations, procedures, and remedies. At one particularly desperate point, she experimented with unconventional methods at home, including applying hair removal cream to her face in hopes of clearing up the problem, which unfortunately resulted in burns and further irritation. She consulted numerous specialists, visiting over 20 doctors in her search for answers, and accumulated significant medical debt in the process. Insurance providers repeatedly denied coverage, often dismissing her symptoms as mere inflammation or reactions to old cosmetic fillers, leaving her to cover the costs herself and straining her finances to the point where she felt overwhelmed and fearful about her future stability. Her condition worsened over time, leading to additional symptoms beyond the visible changes to her face. She began experiencing hair loss, particularly noticeable on one side, prompting her to wear hats frequently to conceal the thinning areas. Joint pain and stiffness became persistent, making simple movements difficult, and she found herself needing to massage her neck constantly throughout the day. The toll was not just physical, it isolated her socially and emotionally. She described spending 3 years largely confined to her home, feeling like she was living in a nightmare, with moments so dark that she questioned whether she wanted to continue. A turning point came when she connected with an infectious disease and immunology specialist in New York City. The doctor reached out after becoming aware of her public pleas for help, and their consultation provided some relief and hope. Following treatment under his care, she shared images showing significant improvement in her facial appearance, expressing gratitude and excitement about reclaiming aspects of her life that had been on hold. She spoke optimistically about future possibilities, including dating again. However, further investigation revealed that the root cause was not solely parasitic in nature, though she maintained there had indeed been a parasitic element involved. The primary culprit turned out to be complications from breast augmentation surgery she had undergone approximately 18 years earlier. The implants had ruptured completely on one side and leaked extensively on the other, allowing silicone to migrate throughout her body, particularly lodging in her lymph nodes. This migration clogged the nodes, preventing proper drainage and triggering a systemic infection that manifested prominently in her face. The silicone spread created an environment where inflammation and infection could thrive unchecked, explaining the persistent and severe symptoms that had baffled so many previous doctors. Realizing this, she underwent corrective surgery to remove the problematic implants. The procedure took place with a Beverly Hills plastic surgeon experienced in complex cases. On the day of the operation, she expressed profound relief that the moment had finally arrived, despite feeling terrified about what might be discovered. The surgeon described the case as complicated, noting uncertainty about the extent of the damage until the incisions were made. During the surgery, he found one implant severely torn and ruptured, far worse than anticipated, requiring careful extraction of the remnants and suctioning of the escaped silicone material. The other implant remained intact by comparison. Following removal, new, more modern implants designed with lower rupture risk were placed to restore her previous enhancements safely. In the recovery period afterward, she noticed immediate positive changes. Her joints felt markedly different, allowing her to sit and stand without prolonged discomfort or the need for constant neck massages. The overall sense of physical relief was overwhelming after years of struggle. She reflected on the long-term nature of the issue, having had the original implants for nearly 2 decades. They had appeared and felt normal externally, and even routine mammograms had not flagged problems. It was only after insisting on additional imaging, such as a sonogram, that the rupture became evident. This experience taught her a hard lesson about breast implant maintenance. She now advises others to replace implants after about 10 years rather than adopting a, "if it's not broken, don't fix it" mindset, as complications like breast implant illness can develop silently over time. Currently, she continues working with multiple specialists in Beverly Hills, including one focused on laser treatments and other non-surgical interventions to address the accelerated aging effects from the ordeal, which she likened to suddenly looking 20 years older. The surgeon who performed the implant removal emphasized the importance of rest during recovery, Though she admitted struggling with that directive after being homebound for so long, she felt eager to re-engage with life. She also mentioned needing dental work after having several teeth extracted due to related health impacts, joking lightheartedly about feeling self-conscious but determined to address it. Throughout the ordeal, she emphasized the financial and emotional strain, including depleted savings, maxed credit cards, and a sense of lost independence at her age. She credited a healthcare strategist for helping navigate insurance disputes and advocated for vigilance in monitoring implants, suggesting sonograms over mammograms in some cases to avoid potential rupture risks. The journey has been one of resilience, from despair to cautious optimism, as she aims to move forward and embrace life again after years of isolation and pain.